Good afternoon, everyone. We're going to wait just another minute or two to allow for some additional folks to sign in, and then we're going to go ahead and get started. Good afternoon, everyone. We're going to go ahead and get started. Thank you for joining today's webinar, 5 Years of Stepping Up, a virtual roundtable. We are thrilled that you all are here and able to join us today for this exciting kickoff event. My name is Katie Habert, and I'm a program director at the Council of State Governments Justice Center, and I've been working on Stepping Up these past 5 years, so likely know a lot of the folks that are joining us today, so welcome. On behalf of the Stepping Up partners, the National Association of Counties, the American Psychiatric Association Foundation, and the Council of State Governments Justice Center, I'm very pleased to welcome all of our attendees today to celebrate the 5th anniversary of Stepping Up and launch the next Stepping Up call to action called Set, Measure, and Achieve. To share their support for the work that you all have done and will continue to do as Stepping Up moves forward, we're going to begin today by sharing some prepared remarks with you from Stepping Up leadership. After those remarks, we're going to provide a short overview of the Set, Measure, Achieve call to action, followed by a dialogue with several of our Stepping Up Innovator Counties on their successes so far, their commitment to this next Stepping Up call to action, and why they hope that you will join them in this endeavor. Before we get started, I want to mention just a few quick housekeeping items. If you encounter any technical issues during the webinar, you can call WebEx Technical Support. We've included that number in the chat box on your screen. We'll also be sending out links and information throughout today's webinar through that chat box, so please familiarize yourself, with that feature. This roundtable is also being recorded, and a recording will be posted on the Stepping Up website by this time next week. Unfortunately, we won't have time during this roundtable for a formal question and answer session, but we still do encourage any questions from you all who are listening in. And so there are a few different ways that we'll make sure to get any questions you haven't answered. One of them is to please feel free to type questions into the Q&A panel on the bottom right-hand portion of your screen. And what we'll try to do is reply to those content-related questions in real time. And anything that we don't get to, we'll make sure to follow up post-webinar. You can send questions to the Stepping Up email information line, which is info@stepuptogether.org. Also will be located in the chat box, and we'll email you back with a response. All of the panelists today are happy to follow up with you via email, so we'll have a slide at the end of the webinar that lists all of their contact information in case you'd like to reach out directly. And we're also hosting a follow-up webinar on October 21st that will cover some additional details about what we're talking about today. We'll dive much deeper into setting baselines, how to track progress, et cetera. And the registration announcement for that webinar will be out on October 7th, but that webinar may also answer some questions and be an opportunity for more question and answer and back and forth discussion. With those housekeeping items out of the way, the first item on our agenda is turning to hear from the leadership at NACO, APAF, and CSG Justice Center. So Eunice, if you don't mind playing the video. All right, well, thank you to Dr. Geller and Sheriff Katusian and Judge Moore for your comments. We very much appreciate them. If folks had any trouble with, if folks had any trouble hearing the video, it was recorded, it is being recorded, and we'll be posting that, so you'll be able to have access to that next week as well. Thank you again to Stepping Up Leadership for your comments. Again, it's just really amazing to see how the initiative started in 2015 and grew to over 500 counties committed to stepping up today. And you all have done amazing hard work, a small but very meaningful fraction of which we're going to hear about today during our roundtable with some of our Innovator Counties. And we at Stepping Up feel very honored to continue to support you in your efforts in any way that we can. You know, as one of the managing partners of this initiative, one of the many things that has stood out to me in particular is the longevity of commitment to these challenges as well as opportunities among so many different types of stakeholders in your local jurisdictions. And I think the commitment to continuing this hard work, you know, together to really make a difference in individual lives and families and communities and to better our systems is very noteworthy and cause for celebration. And you all have been engaged in these efforts for years. Many of you before Stepping Up was established, and it's all of your commitment on a daily basis that has really made Stepping Up successful and sustained and focused on these important issues. So thank you for all the work that you've done and continue to do. As a continuation of your efforts, Stepping Up is really moving forward to support counties in a new call to action called Set, Measure, Achieve. And please refer to the chat box. We're going to be putting some links in there to some resources and additional information. Some additional information can also be found on our website at www.stepuptogether.org, including a new written brief on this call to action, Set, Measure, Achieve. We'll also be sharing this information at the end of today's event, along with some additional information on how to get involved and some upcoming support that we want to offer as well. Over the past few years, we've worked together to really understand who's in the local justice systems and the high impact strategies and policies that can really help us make change, especially using our accurate baseline data to understand the full scope and needs and opportunities. And this call to action really builds off of that work that we've done together and encourages us to take the next step by setting a public reduction target or targets, measuring progress, and achieving and recording results. And I'll go through those a little bit in more detail now. In terms of setting a public reduction target or targets, these reduction targets really mirror the 4 key measures of Stepping Up, reducing jail bookings, reducing average length of stay, increasing connections to care, and reducing recidivism, along with decreasing your average daily population. So while the Stepping Up measures are really focused on the jail, most of the strategies and solutions to really reduce prevalence are found outside of, but of course in partnership with, the jail, and really require collaboration across systems at all points, you know, from crisis, law enforcement, courts, community supervision, et cetera. You know, in this way, focusing on the jail and measuring progress is really symptomatic of how well systems are working together overall in a community to ultimately reduce incarceration for people with mental illnesses. In terms of measuring progress, we really want to focus on both the actual numbers as well as those really impactful steps that we take on our way to achieving a reduction in prevalence, such as investments in screening tools, key personnel, evidence-based training, et cetera. And then, of course, achieving and recording results and being able to name a shared goal and see your achievements and what the progress and has been to reach those. So Stepping Up is really committing to providing resources and support at each of those steps, you know, including how to set targets and calculate progress, as well as a technical assistance focus on bringing you those high-impact strategies that focus on real, in-depth, how-to examples from your colleagues, some of whom you'll hear from today. And we really think that as a result of this work, counties are going to be even better positioned to identify successes and opportunities and really allowing for more targeted and data-driven requests for local, state, federal, philanthropic support. And setting that kind of reduction target will also help amplify counties' transparency efforts and really ensure coordinated planning and progress tracking across multiple systems towards these common goals. We know it's an understatement to say that this year has been tricky for lots of reasons, and in particular for data collection and setting baselines and targets due to COVID-19. However, we think that there really are options that we're going to talk through even further in the webinar on October 21st that I mentioned. We know from numerical and anecdotal data that some of which you'll hear about today, that many county jails are seeing the proportion of people with serious mental illnesses in the jail remain the same or even increase during this time. And so this work continues to be very important, maybe even more so in light of our current challenges, as a way to really ensure that people with behavioral health disorders can really be safely served in the community. As we move into the roundtable portion of the event, just another quick housekeeping item for those who may be less familiar with WebEx software. If you want to see a gallery view of the panelists on your screen through WebEx, please refer to the chat box for instructions. Again, just in case you aren't as familiar with this software, we'll have some instructions for how to have that gallery view. So we now want to move into discussing with some of our innovator counties their successes that they've achieved over the past 5 years, as well as what targets they want to commit to moving forward. The counties you're going to hear from today really represent a group called Innovators, of which there are currently 23 and counting, which are stepping up counties that have achieved accurate baseline data through a shared definition of serious mental illness across behavioral health and criminal justice, universal screening at booking with a validated tool and follow-up assessments, as well as the ability to track and query data and information electronically. They also represent many other counties who have made real progress towards reducing prevalence. So I'd like to introduce Dr. Aisha Delaney-Brumsey. Dr. Delaney-Brumsey is the Division Director for Behavioral Health at the Council of State Governments Justice Center, and she joins us today to help moderate this discussion with our panel. So please welcome Dr. Delaney-Brumsey.
Thank you so much, Katie. Welcome to everyone, and I'm really glad to be here today. Before I begin, what I'd like to do is, of course, thank you all, but also extend a special thank you to our innovator sites who are announcing reduction targets and participating in this roundtable today as we launch Stepping Up's next call to action. So over 500 plus Stepping Up sites have worked hard over the last 5 years and are now taking on the next challenging phase of setting and meeting reduction goals. And so before I turn to our expert panel, I'd like to ground today's discussion in just a brief reflection on why the challenge that you all are engaged in today is so important. So as I reflect on the first 5 years of Stepping Up and look forward to the next phase, I try to keep in mind the fact that people, family, neighbors, friends, are the foundation of the numbers we are seeking to set, measure, and achieve. People who many of us know, love, and respect, people who deserve our time, attention, courage, and work. Serving those people is what brings us here today in the midst of a very daunting year, one that's been daunting for all of us and daunting for the people incarcerated in our county's jails. I'm certain that every person in this virtual room has been moved and shaken by the events that we're living through, from the massive losses related to COVID to nationwide protests and more. And while these are painful times, these events have illuminated a need for fundamental change in a way that we have not experienced in recent history, and has also demonstrated that change is possible. What we saw was at the peak of COVID, jail incarceration dropped fast, 25% between March and June. And though we've begun to see a rebound in those numbers, we have an opportunity to double down our efforts and to redirect that trend downwards. Many people in this room and on this panel are working to make that a reality, and in particular, working towards a world in which we are able to keep people with serious mental illnesses out of jail whenever possible. We know that the road to our destination is not always easy. There are roadblocks that have and will appear along our path. For example, as you heard earlier, we've heard from many of you, our partners, that people with mental health conditions were some of the most challenging to help return home from jail, even before COVID, and in particular during COVID, despite the fact that jurisdictions were pushing very hard on jail reduction. And this speaks to the importance of the efforts you and the other communities in the Stepping Up Network have undertaken. I'm also very excited to see so many of you doing work to address the needs of people of color, Black and Latinx people who continue to be disproportionately represented in our jails. To be Black and living with a serious mental illness and justice involved can be a heavy burden to bear. So as we set, measure, and achieve reductions in the number of people with serious mental illness incarcerated in our jails, it's important to put the people who are most marginalized at the center of our efforts. For certain, the challenge you're meeting is a tough one, and it will be made no easier by the likely recession we are facing and the potential cuts to mental health budgets and other community supports. But while tough, I don't see a reason for us to be dismayed. The work of the communities on this call and across the wider network, the work that the communities on this call and across the wider network have done over the last 5 years is a testament to your persistence and to your leadership. And the fact that you are all here today, united around those goals and renewing your commitment to improving the health and well-being of people with serious mental health conditions is to be celebrated. So thank you for offering me a moment to highlight the power that we can exercise, and I'm excited to turn things over to our innovators to share their insights, lessons learned, and guidance. So I'd like to introduce our distinguished panelists, and they include Michael Brower from Douglas County, Kansas, who's the Criminal Justice Coordinator there, Michael Daniels, Director of Justice Policy and Programs in Franklin County, Ohio, Allie Dickinson, Criminal Justice Coordinator from Johnson County, Kansas, Meg Perillo, from the Stepping Up Coordinator from Montgomery County, Pennsylvania, Margarita Chavez Sanchez, Director of the Department of Behavioral Health Services in Bernalillo County, New Mexico, and Ashley Berg, Social Worker from Sarpy County Public Defender's Office. Excuse me, guys. So thank you all today, and I'm going to be kicking off this discussion. I have a few questions first for our 3 sites that established baselines early off in the early years of Stepping Up and have already demonstrated reductions in the number of people with serious mental illnesses in jails. We're very excited to have them here today. So first, Mike, can I turn it to you? Douglas County has been working on reducing the number of people with serious mental illnesses in jails for several years. You achieved a reduction of 18% in 2014. But you achieved a reduction of 18% in 2014 to about 6% in 2019. And you have the goal to decrease your prevalence rate to 5% to parallel the rate of the general population. This past year has been extremely challenging for jails managing COVID, as we mentioned before. And you are seeing that during COVID, your serious mental illness population has not reduced along with the jail population and has in fact increased. Can you tell us a bit about the strategies you plan to implement to address this?
Yeah, thank you, Aisha, for the time and for this opportunity. We did see, our rate of booking people with serious mental illness in the jail during COVID has increased by almost 40% to 12.3% of our bookings. And while the overall number of people being booked has decreased significantly, it's the ratio of people with serious mental illness to the general population that has increased. And as you said earlier, it's also been a great difficulty in trying to provide quality discharge planning for these individuals during this time of COVID-19. So what we've been doing is we've been trying to do a better job of making sure that we're tracking referrals to treatment for people in the community. We're formalizing that we're communicating about screening and assessment that we do in the jail when people go out into the community, and trying to make sure that there's a really solid connection being made.
Thank you so much, Mike. We appreciate the work that you're doing and also the work that you're doing to meet this particular challenge. So next, if I could ask Michael from Douglas County, Kansas, from Franklin County, like Douglas County, Kansas, who's also been at hard work to reduce the prevalence of people with serious mental illnesses in your jails for several years. In fact, you're one of the first sites to set public reduction targets And Franklin County was also one of the first sites to declare racism as a public health issue. Could you please explain how SET, Measure, and Achieve will be used to track your data related to race equity and meeting the challenge of racism as a public health issue?
Sure, Aisha, and thanks for the question. Thanks to Katie and the rest of the team for organizing this and asking us to be. We really appreciate it. I think what we will be able to do, given the situation now, is to be able to use the platform, the backbone that we learned from Stepping Up. Is that me making that sound or somebody else?
That's your phone, I think.
That's really unfortunate. Skip me and let me see if I can call in and come.
Absolutely. We'll come back to you. We'll come back to you for sure. So then, Meg, if I could turn to you, Montgomery County has established a baseline of 257 people in your jail with serious mental illness dating back to 2017. And you reduced that number to 215 as of 2019. This represents a 16% reduction. Based on this great work, you're proposing an additional 5% reduction in bookings of people with serious mental illness. Could you tell us a little bit about how you've made such great progress and what you plan for reducing an additional, in order to reduce an additional 5%? In addition, if I could ask you two questions. You've stated that having a Stepping Up planning team in place better positioned you to respond to the COVID-19 pandemic. Could you talk a little bit more about the benefits of Stepping Up and the role of stakeholder collaboration in that response?
Sure. Thanks for having us. Montgomery County, fortunately for me as the Stepping Up coordinator in Montgomery County, has been a committed county for several years now, even dating back to 2007 when they had their first intercept mapping. As a result of that resulted in creation of treatment courts and mobile crisis and mental health and criminal justice related mental health case management and specialized trainings for police. And of course, just overall having the commitment from the commissioners. So in 2017, we actually joined Stepping Up through a signed resolution, which really just continued to reinforce the foundation that was already laid. And so through Stepping Up and the need to track and collect data, which is really the cornerstone to what really is the magic behind this, I think, is by having those measures and really forcing us to look into certain areas, it really allowed us to understand our picture as a whole. And so as we continue to work through our processes and looking at policies, we were able to just continue to build a strong enough foundation, which includes a district attorney that understands behavioral health needs. And I think that's something that it can't be overlooked in terms of the success of our clients being able to move through the system, is having a DA that understands behavioral health and is willing to continue to learn it and also to share with other DAs in the system in general. So that collaboration with our public defender's office really continues to allow that collaboration to be successful, as well as our connection to behavioral health centers in the community, justice-related case management, our continued with specialized police training has also continued to help give us success in terms of our SMI numbers. What really also kind of kickstarted through Stepping Up was our retooling of an already existing meeting around reentry. So a meeting that had been going on for a while now, but one where we pulled in Stepping Up, the framework of Stepping Up, which then allowed all of the players at the table to come there free of judgment in terms of how folks got there, but okay, here's the system and here's how we're going to get it through. So everybody from probation to the public defenders, to the district attorney, to the jail, to the community behavioral health centers, to the medical provider within the jail is working towards these folks. That's been huge in keeping our numbers. We still have more work to do and where we want to go, but I think when it came time for COVID to hit, we were primed in a position. We had already a planning team together. We had the process for how to identify folks. We added in an additional loop with the admin dispo process through the courts, and we were actually really targeting folks quickly and moving them along. our biggest barrier continues to be housing, and I know a lot of folks are going to have that experience as well. So housing continues to be a really big challenge for us. As we think about our reduction targets and wanting to lower the individuals that are being booked into jail, that's really where we're going to focus. We're taking two aspects of our data collection, which again, if we were not in Stepping Up, we would not have been primed to do this. We would not have had even close enough to know the interventions that needed to happen. But we're going to look in this next phase of our Set, Measure, and Achieve. We're going to look at our data around our arresting agency, and we're going to overlay that with our police crisis intervention specialist training, and to see if there's any kind of connection between where we're seeing an increase in arresting. Maybe they haven't had the same level of training, so we want to see how that kind of looks together. Another area we're looking at is our reason for admissions. Through our arrest data, our booking data, we really are able to sort through our reasons for admissions, and we're going to take our top reasons for admissions and really try to delve into that, such as violations of probation. We believe between these two, as well as our pretrial services, which is starting, will be kicking off in January of 2021, we believe that this is really going to help to reduce our bookings by 5% in the future. So we will see.
That's fantastic work, and thank you so much for outlining the variety of strategies that you're going to be implementing. I know that one of the things we've seen across the network is that people find it helpful to really use their data to help target a set of strategies and start to implement those in a planful, meaningful way, and that you need multiple strategies and multiple people at the table. So thank you so much for talking that through. Great. So I believe, Michael Daniels, you're back with us, and your audio is working.
I hope that's the case. Is it?
Yes, you sound great. You sound great. Thank you. So
fantastic.
So would it be helpful for you to restate the question, or are you?
No, I'm good. And I appreciate the question. I think certainly what we are going to do is to take the backbone that we've had for 5 years in Stepping Up. And as Meg indicates, we would never have been able to know how to do this without Stepping Up. But over the last 5 years, we've put procedures and partnerships and data sharing mechanisms in place to be able to collect the right data and to figure out how to parse those data correctly to get meaningful answers, and then to implement policies to address where those disparities exist. And where I think that declaring racism as a public health crisis has really helped us here is to reframe the conversation around the overpopulation of people of color, particularly black people, particularly black men, particularly young black men, who are dramatically overrepresented within the jail population. And to be able to say, we don't think that the police hate people with mental illness. We think they simply don't know how to interact with people who are suffering from who are living with a mental illness. We don't think that the system hates people who have substance use disorder, but we do believe that the system doesn't know properly how to interact with people who are living with substance use disorder. And so instead of framing the question of we think that the system hates black people, really we're looking and saying we think that the system doesn't know how to deal with a population that is suffering from the disease of racism. And to be able to truly look at that as not saying, and please make this very clear, we are not equating being black with a disease. We are equating living with racism as being someone who is suffering the effects of a disease. And so if we can look at it like that and say, we were able to do training to help officers and court staff understand the issues caused by a mental health condition. Why can't we do training to help people understand the conditions and situations that are caused by living under systemic racism, and to come at it in that kind of a way, to really take a look at this as a public health crisis that is affecting a significant portion of our community. One would argue that there are more people in our community who are Black than who have substance use disorder or who have a mental illness, and so more people are suffering the effects of racism than perhaps those other two conditions combined. And so how do we take a look across the board and be able to dissect out where those disparities are and address them in exactly the same kind of way? How do we reduce the disparity in length of stay? How do we reduce the disparity in charge level? How do we reduce the disparity in a variety of other things? And what kind of diversion programs or training programs can we put in place so that instead of simply arresting someone because they are suffering from racism or because they are doing something that racism has historically said is a dangerous thing, or because you look at them in a way that systemic racism causes you to believe that they are inherently dangerous? And how do we then put in programs and, if you will, deferrals? How do we have people to understand how we can more appropriately address communities who are suffering from racism, and that racism may hit the Black community in a different way than it hits the Latinx community, in a different way than it hits other indigenous or peoples of color communities. And I think one could extend this to a certain extent into issues where misogyny is the underlying reason for crime or for something being criminalized, or homophobia is a reason as well. So we're really taking a look at how do we address this as a health crisis, and how do we take the backbone structures that we've spent 5 years putting in place under the Stepping Up strategy and simply convert those now to what is a not new but recognized as new public health crisis that we're dealing with regarding race and racism.
Thank you so much, Michael, for those powerful remarks and helping us think about how you're applying a process to address racism in addition to the work you've been doing around addressing the needs of people with serious mental illnesses. And just for everyone in the room, I know we're getting some questions come through from the audience. Thank you so much. If we have time at the end, I'll pose those to the panelists. If not, we'll of course definitely work to get you responses afterwards. We're getting some great questions, so I just want to acknowledge that. Thank you so much, Michael. So next, I'd like to turn to you, Ashley, from Sarpy County, Nebraska. So first, thank you for your continued work in Sarpy. It's one of 2 Nebraska counties that have been named as innovators. We many times see that the average length of stay for people with serious mental illness is as much as twice as long as compared to other people who are incarcerated in the jail. And you are announcing a 5% reduction in your average length of stay for Sarpy County. Could you share with us the baseline you are starting with and your plans for what your strategies are to reduce that average length of stay?
Absolutely. I wanted to say thanks to Aisha for having us here today, too. So in 2019, the average length of stay for individuals with the SMI in the Sarpy County Jail averaged 111.5 days compared to those individuals without an SMI at 15.5. So Sarpy County is committing to that 5% average length of stay reduction, which is going to equate to 105.9 days, or 6 fewer days in jail for every person over the course of a year. We have several strategies to help us meet this objective. Number one being that our corrections will work to have 100% of designated staff trained in crisis intervention training, or CIT, mental health first aid, or both of those. We've been collecting baseline data on these measures, adding county attorneys and public defender offices with their training as well. And that's something that we're reviewing on a quarterly basis. The second strategy is that we have mapped out the process of referrals for mental health diversion and mental health pretrial in order to identify and measure specific data points that impact that length of stay. Looking at mental health diversion, what is the amount of time between arrest and referral to mental health diversion? How many of the referrals are they getting by each different referral source? and then the number of individuals referred versus the number who are asking to participate. In mental health case management in the pretrial, the number of active clients they have each month, the number of new clients that they're getting by referral source, the number that are placed on that mental health caseload but stay in jail because they can't post bond, and then the number who are transitioning to mental health diversion from that caseload. The third strategy we have is that we actually recently formed a work group which consists of members from the County Attorney's Office, Public Defender's Office, our jail, and Region 6 Behavioral Health Care to identify and examine current progression of our cases through the court system in order to identify practices that impact the average length of stay for those with an SMI. Our fourth strategy is to utilize best practices from the Gain Center technical assistance on competency evaluations and competency restoration practices. And finally, we are in the process of identifying a vendor for Sarpy County that will commingle data from various data sources through the use of data sharing agreements, which we would like to result in automated real-time data.
Thank you so much, Ashley. Again, it's helpful to hear the lengths that you're going to really address this problem and the ways that you're tackling it in using different strategies and pulling partners to the table. So really appreciate you being able to share that. Next, I would like to turn it over to Allie. Allie, Johnson County has done a great job in implementing electric notification to your behavioral health providers when someone is booked into jail and when someone leaves, or someone with a serious mental illness. Could you describe how this has improved your ability to help connect people to care, and also the baseline you're using for this and your target for increasing that connection in the future?
Yes, thank you for the opportunity for Johnson County to be part of this panel. In 1993, the county leadership identified the need for the system to have a data-wide collection tool that allows us to share information for individuals that are going through multiple systems or departments. So this led to the creation of the Justice Information Management System, with assistance from another system called My Resource Connection, which is a web-based application for public health, behavioral health, emergency response, and other human services, as well as community supervision. It allows the information to be safely shared among those different service providers. So those two systems assist with those connections to care, and some of it's, and sort of that starts in the electronic notification system that our behavioral health provider gets at the time of booking. A message is sent to the provider, so contact can be made as soon as possible. And we were very fortunate the beginning of this year in 2020 that our local behavioral health provider, which is Johnson County Mental Health, was able to get into the jail and provide those behavioral health needs. And we also have a justice behavioral health team at the jail that started working with individuals while they were in custody. The team consists of licensed clinicians and case managers that allow for support while individuals that have SMI are in the facility, but also continued support in the community once they're released and help with discharge planning. Capturing the connections to care, we started with stepping up the initiative in 2015, but it really wasn't until 2017 that we were able to start collecting some of that information for those connections. In 2018, we had a full year, and we were able to start, tracking that. The definition comes from determining if the provider has contact, whether it's face-to-face or through phone conversation, with the goal to be the contact within 72 hours of being released. One of the key areas that we focused on is the continuity of care. Care coordination is conducted through the county's My Resource Connection. The baseline information that we are looking at and part of this set, measure, and achieve, we're looking at increasing our commitment to 3%, up 3% from last year, so looking at a 31% connection to care. Our community and county are fully committed identifying supporting ways to increase the continuity of care. We have a shared vision. That's one of the great things about here in Johnson County, and a goal of providing high quality and cost-effective assistance to our county's most vulnerable population. This is made only possible by the shared vision, dedication by our community partners, those that are on the ground, and then also county leadership to inform policy and funding priorities.
Thank you so much, Allie. Appreciate you fleshing that out for us, and also the hard work that you've been doing to make sure that people have the support that they need when they return to the community. So thank you. Margarita, can I turn to you? Bernalillo has recently added boundary spanners to work with people who are leaving the jail, and this has been a particular challenge during COVID. Could you tell us how adding those case managers will help increase your connection to care baseline of 30% in 2019 by 10% as one of the targets that you'll be working on in order to manage the services and supports during COVID?
Absolutely. Thank you, Aisha and team, for including Bernalillo County in this critical discussion. So as was mentioned, we here in Bernalillo County are providing the service through our transition planning program and our resource reentry program for people who are leaving the Metropolitan Detention Center, our local county jail, and needing connectivity to services and supports. This program has given us an opportunity to build a platform for which we can screen folks assessing for behavioral health framework, criminogenic risk, and the Council of State Governments Justice Center, who helps us build this screening. This screening tool allows us to identify folks who are high to moderate risk and immediately deploy our transition planners within the jail to begin working with them. Upon release, they then are connected to services in our Resource Reentry Center. And within that Resource Reentry Center, they can be connected to something as simple as, how do I get my car out of impound? All the way through, I have been living on the streets and needing help to access a behavioral health provider. So these two vital components have helped us to establish that baseline. So in 2019, we had 20,860 individuals pass through our Resource Reentry Center, and 6,178 clients, or 30%, were connected to services. Now, again, that's going to be our baseline that we're going to build upon and work to increase those numbers and increase our connectivity. So this past year, we received a grant through the JMHCP that has allowed us to add these 6 additional boundary spanners to our teams. And these boundary spanners will absolutely enhance our ability to connect client to services that they're needing or having difficulty navigating in the community. These boundary spanners will maintain caseloads consisting of the highest utilizers in emergency departments, jail bookings, and within our substance abuse programs here in town, to be able to, again, be successful in the community. Currently, our boundary centers are assigned to 66 of our highest utilizers in the capacity to serve, with the capacity to serve 120 individuals. They'll be providing long-term intensive case management by accompanying these clients to court, to appointments, providing transportation, application assistance, and assistance in basic living skills and activities of daily living. It's our hope that by establishing this rapport and providing one-on-one wraparound care, that we will also in turn reduce this population's admissions not only to the jail, but also our emergency rooms by 5% in the first year. It's our goal to not only connect these clients to services and reduce recidivism, but really provide cost savings and supports to our community resources. Now we talk about COVID and how COVID has really impacted us here locally. Like many situations across the nation, many of our service providers and agencies here locally have tightened up all of their availability, including adding testing restrictions or quarantine restrictions for accessing those services. Likewise, the Metropolitan Detention Center, or our local county jail, has restricted all civilian access. So this created a little bit of a barrier for our boundary spanners to be, and our transition planners to meet with the clients while they're in jail to develop these plans. So we quickly relocated these staff and plugged them into our Resource Reentry Center and other locations within our department, and equipped them with the tools to begin doing video visits with these clients. And again, in the RRC, those face-to-face visits. Since COVID, the RRC has seen a 63% reduction in clients that they see. Now, this is because many of the clients within the jail are housed in quarantine pods and then either transported home or not released through that system because of a COVID restriction. So absolutely, we've seen a significant impact and had to rely on technology here locally to help us continue to provide those face-to-face contacts via telehealth and create, again, the ability to meet with our clients in the Resource Reentry Center. So we're really excited that we've received this grant and that we have the ability to add this component to our existing platform with the Transition Planning and Resource Reentry Program.
Thank you so much, Margarita. That's really exciting work that you're doing and building out that staffing and ensuring that the transition back home is as smooth and as supported as possible. Really appreciate that. So what I'd like to do now is we've been getting some questions coming through to the panelists and to the hosts, and so I'd like to turn it back to the panelists to give them some time to reflect on those questions and to answer. If you don't mind, Michael Brower, can I turn to you first? Would it be possible for you to talk a little bit more about how you use data to establish, to both inform your efforts, but how is also important to establishing some of the trust and work across sectors? Would you be able to speak to that?
Sure, absolutely, Aisha. You know, one of the things that Stepping Up really pushed us to do all the way back in 2017 was to, it wasn't just enough that we were providing assessment within our jail to identify people with serious mental illness, but we needed to track that data electronically so that we could do things similar to what Johnson County, Kansas explained and be able to know who's coming in, what type of charges they have, what are the connections that are made previously. So now that we have multiple years of data and doing that, and as the COVID crisis came upon us, we were able to immediately grab that information and to see the changes that were occurring to allow us to communicate with our community stakeholders to begin making some difference in services. So one of the things that we had working that had not fully implemented was, increasing our mobile crisis services in the community, especially responding to people who were, as Margarita talked about, as high utilizers, making sure that they're getting connected with service providers in the community so that they're less likely to be coming back to jail, because as we talked to our law enforcement officers, they simply felt, especially as COVID numbers were rising, sometimes they just needed to get these people off the streets and they didn't have a better option for somewhere to put them. And that better option is something our county commission has been working on. One of the things too is looking at the numbers is we had planned to build a crisis center for our community. But as we began looking at data, it told us a story that it wasn't just the 23-hour crisis services that were necessary to address the needs of our community, that we needed to provide respite care services. So we created what you call problem-solving beds. And then we had an element of the population that needed long-term support. So we're in the process of opening a 3-phase recovery campus. And later this month, the County Commission will be cutting the ribbon to open our long-term supportive housing and those problem-solving beds, with next year a plan to open our crisis center. And so the data that really this initiative has urged us to collect has been helping us to make better informed decisions about how we spend our public resources.
Questions that are coming through also around being able to show some return on investment or savings or other types of ways to make arguments around the necessity to do this work. And so I will say that, and I'd like the panelists, if anyone has some time to think about that, and then I'll circle back on that question, because what your comment just raised that for me, Mike, and I think there's probably many people on this panel who could speak to that as well. So thank you so much for that, and hopefully we'll be able to come back to that. There was also a question that just came through around housing. And I think, Michael Daniels, if you don't mind, if I could turn to you to speak to that. The question is really around the necessity of getting people housing when they're leaving jail, and your experience or data from your jurisdiction around the differential success of people who are able to leave jail with housing versus people who are not, who are leaving jail without housing, and also some strategies that you may have tried or would like to try in your community to increase access to housing, which for everyone we talk to is a huge challenge.
Sure. I mean, housing is probably the biggest challenge that we face, quite honestly. We have done some work here. We have secured some funding through the state of Ohio using a program specifically designed as an alternative to prison program, supposedly to be focused on low-level nonviolent felons, and we've expanded that to include some other folks as well. But it's very much the FUSE model of the Corporation for Supportive Housing, and so it is a time unlimited, if you will, or not a short time restrained permanent supportive housing option that is very much a housing first model. And so we do not make that housing a reward for participation in some other program. So it's not like if you go to X number of counseling sessions, then we'll house you, or if you get sober, then we will house you. It's we will house you, and then we will use that as a launching pad for you to achieve those other goals. And perhaps that might be on your time, not necessarily on ours. We also that way sort of don't have to try to dig into do we have someone with a mental health disorder and a co-occurring substance use, or do we have someone with a substance use disorder and a co-occurring mental health? We don't have to try to parse or split hairs or try to come up with differences without distinctions. We just put people into housing. Our preliminary data after doing a year of that programming, and the numbers are relatively small, 25 people in the housing group, I think 22 people in the housing group, 20 people in the non-housed group. But in the first year, we saw about a 50% reduction in recidivism, several 100% reduction in the actual number of days spent in the facility. So people are coming back fewer times, and each time they come back, they are staying for shorter periods of time. And at the end of a year, 100% of the people in the housing program have remained housed, because when you put the permanent supportive housing model like that in place, if they go back to jail for fewer than 45 days, we keep the apartment waiting for them so they have some place to come home to. That's also helped the bench to be able to say, if we release you on a recognizance bond, you have somewhere to go. You're not going into just the wind. And, of course, you have as much or as little, but as much case management as you would like to have as part of that program as well. It is certainly not inexpensive. If you're looking to do that, to say, we're going to save this number of jail nights at X number of dollars a night and use that as your standard, it is not necessarily what one would say cost effective, if you will, but our commissioners take a much more holistic view of what is the return on investment for that individual to be in the community, to be reunited with his or her family, to be re-engaged with his or her children, to be re-engaged with his or her community of faith and other places, and the trust that it builds in the community of when someone from our office or another arm of our criminal justice planning board says, we'd like to help you in a program, people can now believe them because they've seen this type of thing work, and it doesn't look to them like many of the old programs did, which were sort of a bait and switch. The minute you fall off the wagon, we'll take your housing away from you. Well, I know I'm going to fall off the wagon, so why should I bother to get into housing in the first place? We've sort of taken that away. Very short-term study, very small number of people, but very promising.
Thank you, Michael. I'm really glad to hear you elevating that to low barrier access to housing and harm reduction approach that you're seeing to be really effective. That's really helpful to hear. Margarita, I know that you've also put in place some strategies around housing that I think would be helpful to share as well. Can I turn to you to comment on that, please?
Absolutely. So here in Bernalillo County, we recognize that a continuum of housing is required for the clients that we serve. There are many clients that need transitional living, right? They need a short-term stopgap so that they can maybe get employed or navigate resources or supports or resolve situation with their family. And so building out a continuum has been vital for us. We've actually partnered with the city of Albuquerque to provide funding for motel vouchers. And so clients that come directly out of jail and are needing that stopgap support for short-term housing, we can provide a motel voucher to help for that as well. Now, further upstream, we know a number of our clients are needing permanent supportive housing. They've maybe been homeless for a number of years, and the HUD definition of homelessness does not fit for this population. And so we have been fortunate to have funds available for our Community Connections program. Our Community Connections program is a permanent supportive housing program that works with the highest utilizers in the jail system, in the criminal justice system, and in the community. So it could be for a client who maybe has never hit the jail, but is recidivating in and out of an ER or a drug treatment program and is needing that support. So this Community Connections program works with our county housing department and our contracted case management providers. And now I will say something that's a little bit contrary to what Mike was mentioning, is that this is not a housing first model, right? Because a lot of these clients, while housing is vital for them, just putting a roof over their head is not all that they need. They need the additional intense supports because it's just not a voucher that they need. And so our model pairs case management support with the voucher. And so there is a requirement that the clients work with the case manager. It does not mean that they need to be sober. It does not mean that they need to meet with the case manager daily or even weekly. But there does have to be a level of rapport established with their case manager to plug them into the necessary supports in the system. Now, a number of our clients are requiring this permanent support potentially for life because of the level of behavioral health need that they have. But others, once they've been able to connect to services, maintain that support, maintain their medications, we want them to graduate into a different level of housing support. So again, the option is for this housing support to be permanent, but we want folks to graduate into that as well. Another piece that I'll mention that is really critical to our continuum, and we're really excited because we officially broke ground on one program and are almost there on another program, is our single site supportive housing component. Now, these are going to be for the clients who can't make it in a scattered site model. Just a voucher somewhere in an apartment complex where a case manager checks in with you a couple of times a month is still not enough because the level of intensity for these clients is so high that they need to be able to literally go downstairs and access peer support. And so we have invested, actually it's over $9 million in 2 different initiatives for single site supportive housing units that will be units that will have the whole first floor built in behavioral health support. There'll be 24/7, 365 peer supports at a front desk. And someone can just walk downstairs and say, hey, I'm not feeling right, something's going on. And that peer can help them in that moment do crisis mitigation. And then case management, behavioral health supports, and things like that will be available on that first floor. So we don't have to navigate a bus system. We don't have to navigate transportation. They just go immediately downstairs and get connected to those services. So while those 2 projects are not live yet, but we're really excited that the county has invested in those programs, and we've worked with the community as partners to do that. So this is a way for us to build that continuum so that if somebody is really an acute SMI that's needing that intensity of just walking downstairs, we have that available. Or if someone's needing short-term transitional living, we can have that as well. And so we want to meet the clients where they are, along their stages of change, along the continuum, and provide those supports for them at that time.
Thank you so much, Margarita. And I know that everyone on this panel in various ways is touching the strategies around housing. So I know there's a real diversity of the way that jurisdictions are approaching this. And thank you for illuminating how you're doing it. Ashley, I feel like you have not the exact same perspective, but you've also been thinking about the ways that you've been able to get buy-in within your county around the goal of decreasing average length of stay, bringing all the community partners together and thinking about how that strategy could ultimately also save, not of course be important for the individuals who are not going to be incarcerated for as long, but also reduce the burden on county systems and produce cost savings. Could you speak to how that has been part of your discussion?
Yeah, so I think when we look at decreasing the average length of stay for individuals, that kind of goes hand in hand with decreasing cost in general. And one thing that I think we've been really successful at here in SARPI is bringing in different partners. So for example, the strategies that I mentioned earlier, a lot of them have to do with different departments within Sarpy County. And when we start to bring those people to the table to give input and start to see how what they're doing does affect our long-term goal, the more buy-in that we're able to get for them. One of the big ones I had mentioned is that work group that we just formed to look at case progression. And in order to do that, we're kind of looking at that individual's process through the entire sequential intercept map from, 0 all the way through. And in order to do that efficiently and with the most information, we pulled in representatives from the county attorney's office, here in our public defender's office, representatives from the jail. We are looking at what law enforcement is doing, as well as our community agency partners, to really take a look at what is stalling those cases out, if that's the issue that's causing those average lengths of stays to increase for those individuals within SMI. Looking at systemic issues and themes that explain, why they're having a slower progression, bond amounts, charges, judges, and really getting a different perspective from different people within Sarpy County and the justice system and the behavioral health system to get some input on that. Ultimately, everyone coming to the table to work together on that identified goal and to get that individual out of jail, but also to look at cost savings as well.
Thank you so much, Ashley. It's helpful to hear how you're using that to really engage the other stakeholders in your community. We're getting some questions about that touch on kind of front-end strategies, and particularly strategies around working with law enforcement partners. And Ali, I know that you've done a great deal of work around your co-responder model, and it has done a lot to scale that model up and use data to really be able to enforce the need for that and also make the case for scaling that. Could you speak a little bit to that? I think that will be helpful for some of the questions that we are getting.
Of course, yes. So here in Johnson County, we're very privileged to be able to have the opportunity for co-responders, which are licensed mental health clinicians, to be embedded in our local law enforcement. We have 20 different counties and 17 different law enforcement agencies. And so when it first started, we started with one, of course. And what we were seeing was the success of having a co-responder on the scene when there was an indication that maybe behavioral health needs were needing to be met, and it diverting it as from it not being necessarily a criminal call, criminal offense call through emergency contact, but it being a mental health concern. And so with that, it allows co-responders to be on the scene. And then with our data management system, they're able to code whether they were able to do emergency room avoidance or jail avoidance because of that. And then that data being collected, the mental health center has been able to go before our county leadership and say, these are some of the diversions we've been able to do in the multiple systems. Like some of the other panelists had talked about, we have multiple people that go through different systems, and they aren't necessarily getting their needs met on the first context that they have or the area in which they actually need assistance as it being opposed to being criminal. And so that information being collected through the justice information gyms, what we call gyms. It's hard for me to say because we call it gyms here. And then also being filtered through my resource connection, it allows for that data to be collected and presented at time at budget. And so that's been a key tool for us to help build the program. From, I think it was as of 2 weeks ago, we had an 11th co-responder added to our county.
Thank you so much, Allie. So we have, I think, maybe time for one, maybe two more questions. We just got a question around certainly stepping up this focus on helping counties achieve this goal, and we know that that's where the heart of this lives because we're talking about local jails, but we also got a question about the role that states have in supporting and funding and directing these efforts in your communities versus how much counties are doing this on their own and working independently, and really the role of the state as a source of support. Mike Brower, can I turn to you to kick us off with an answer to that?
Yeah, absolutely. Thank you, Aisha. In Kansas, of course, we're right next door to Johnson County, and so we've been very active in this work. We also have informally been active in working with other counties around the state, providing support. When Risa or Katie come to town, we would drag them to another county to present the program and offer up their email addresses for additional support, as long as encourage people to attend webinars. And then we heard about the work that's being done in the state of Pennsylvania, where there's a virtual technical assistance center, a really stepping up initiative. And our state of Kansas became very interested in that. A few of us are fortunate enough to serve on the Governor's Behavioral Health Planning Council, and encouraged a connection be made around stepping up to the state of Kansas. So we're actually in the process of right now finalizing the contract to implement a technical assistance center in the state of Kansas, so that we can increase not only the number of counties that are involved or past stepping up resolutions, but also the level of support they receive to actually bring this more than just a resolution, but to a point of action. And so we're also really excited about set, measure, achieve, because I think it develops a real good framework for helping these new counties understand why we're collecting this data and how we're going to utilize it.
Thank you so much. And we have about 5 minutes before we have to start wrapping up. So I was wondering if what I could do is turn just very quickly to each of you to say one sentence for you on why you think it's important to set a goal, under, set, measure, and achieve. You've been doing this work for a long time, and so you're no stranger to setting goals, but we know that this is a new phase of the work, and I'd love to hear if you have just a final reflection on that importance. And what I'll do is, if I could, I will start with, since Mike, you just talked, maybe I'll start with Michael Daniels and then go down in order across the panel, and then come back to you, Mike. And if you guys could keep it just to a sentence, I think we'll manage to be on time, and thank you so much. Michael, can I turn to you?
Sure. I think it's important to set these goals because you get what you measure.
Beautiful. Thank you. Allie?
I think it's important to set these goals because everyone matters, including the most vulnerable populations.
Thank you. Meg?
I think it's important that we set this publicly and commit to this reduction goal, and that by tracking our ongoing progress, this will focus our attention to achieve these goals.
Thank you. Margarita?
I would echo what my colleagues have said here, and I would say that it's critical to ensure that we have data in all of our practices, and setting a goal, a tangible, a SMART goal, right, helps us to use data to drive our work.
Thank you. Ashley?
I think it's important for us to set these goals because it keeps our work driven in the right direction, gives us a purpose, and also holds us accountable to the work that we're doing.
Great, thank you. And Mike Bauer, can I turn it to you to bring us home?
Yeah, for us, really, this is a part of our commitment to our community. And so setting a goal, putting it out in the national panel group here, but also putting it on our county website, putting it out on social media is going to show the commitment that we're making to the county to continue to improve the life of these vulnerable populations.
Thank you all so very much. This has been really illuminating to hear the work that you all are doing. I hope that if for any participants who didn't have their question answered, please do reach out. We will do our best to get those questions answered. So I'll just close this out. And again, thank you for your participation today. And thank you to everyone who joined us for this launch of Set, Measure, and Achieve. I'm sure that, as I said, you have many more questions for us. And first, I'd like to say that we are releasing a new Stepping Up brief on Set, Measure, and Achieve, which will be available on the Stepping Up website. Please do check that out. That may help to answer some of your questions and help to get you on the path forward to set, measuring, and achieving your own goals. And also, we're going to make the link to that available in the chat box. And so as a follow-up, we are also going to have a webinar that will go into deeper detail and more granular information on Set, Measure, and Achieve and the call to action. So this will include a review of specific steps that you can take to join the call of action, and that's scheduled for October 21st in just a little bit over a couple of weeks, a little over 3 more weeks. And as usual, that webinar will be recorded and available on our Stepping Up website, as will this one. And we will have a new page dedicated to Set, Measure, and Achieve. And so we'll be able to send out that webinar invitation shortly, and you'll have access to all of that information. In general, you're able to join this work by emailing us and using the Stepping Up information email that will be in the chat box below. And we plan to be communicating with our participating sites and providing continued guidance around this new phase of the work and providing support through our Stepping Up partner organizations and the Innovator sites. So we are so very excited to begin this new phase of the work with you. Thank you all for your continued work and for your continued commitment. And as I said, if you do want to reach out to any of us, we're all happy to respond to questions. Here are our emails. Thank you all very much, and have a good rest of your day.